taking a half an hour out of your life tonight to learn about what I consider one of the most, it's the most important system in the body for keeping us healthy. That's our nervous system. So I talk a lot about a lot of things. I have like 30 different talks. Next time we do this talk, we're going to talk about herbal health and how herbs affect the body. And that's all very good. Herbs are important. But this is the most important. This is the main thing. This is the main course in health right here, or certainly one of them. So this quote here, and let me just get the full screen here. There we go. So health is supposed to be our natural state. You know, I believe God created us to be healthy people. You know, the fact is we've screwed it up. I mean, that's just the long and short of it. So my job as a physician is not sort of push people into health, okay? My job is to remove barriers so people's bodies can work like they're supposed to work. Now, sometimes when they've been, you know, beat up enough, they can't ever get back to where they were supposed to be, but at least we can make people healthier, okay? We might not turn people into Olympic athletes, but we can make their bodies work a lot better. So if we look at the nervous system, we call this a safety pin cycle. We have this, what I call this God-given rescue mechanism. And so what happens is we have the brain, we have the body, and we have these loops of communication, okay? So we have the brain that communicates with the body through the nervous system. Body communicates with the brain through the nervous system. Hey Randy, good to see you. All primary care doctors who care for people with the intention of expressing life and making them healthy know this, okay? If we look at this law, this is not just privy to chiropractors. Chiropractors are not, we didn't make this up. This is a physiological, scientific fact, is the body sends messages to the brain letting it know what it's experiencing, okay? So I'll give you an example of that. If you, let's say you're sitting in a noisy place for a long period of time, do you sense that noise? Do you hear that noise? Yeah, you do, okay? Come on in, Robbie. But what happens over time? What happens over time? Do you hear that noise as much? You stay there? You ever been like at an airport, you know, where there's a lot of noise, people are milling around. Eventually, you can tune it out, can't you? Your brain will allow you to do that. And so your body experiences something, it sends it to its brain. The brain sends messages back telling the body how to adapt. Okay, these are loops of communication. So here's the way I remember them. The efferent pathway is like the brain bubbling over information to the body, like effervescent, okay? That's how I remember these. The afferent pathway is the body's communication with the brain, and they're in constant contact with each other. And this is what it looks like here, the autonomic nervous system. So anyone who doesn't understand this before implementing a diagnosis is violating one of the fundamental laws of life. Because what if it's a nervous system issue that's causing the problem, but the person's getting pharmaceuticals for a problem that's a nervous system issue? It's not going to work. Okay, we'll talk about that later on a little bit more. So how important is the nerve supply from the brain to the body? Look at bad scenario number one, the guillotine. So we know when the head is severed from the body, what happens to the individual? They die instantly, because we cannot live for 1 second without nerve supply from the brain to the body. You know, so the French discovered that. Cut somebody's head off, they die. The electrical supply from the brain to the body is completely severed. What about bad scenario number 2, Christopher Reeve? So he had that bad horse riding accident. He partially severed his nerve supply, but not all of it. So what happened to him? Paralyzed, neck down, okay? Yeah, it was, that was like above C5, so he could barely move his arms, okay? So that's a pretty bad scenario. Look at bad scenario number 3. Subluxations interfering with the nerve supply from the brain to the body. So this is what chiropractors treat. So a minor subluxation can cut off 60% of the nerve flow to an organ or a muscle. Do you think your body needs that 60%? Yes. I would think it would, okay? What if you cut off 60% of the gas flow to your engine in your car? Would it run right? No. Or 60% of the oxygen flow? No. Wouldn't run right, okay? Guess what? Our bodies don't either. So chiropractors are trained to correct subluxations. So a subluxation that causes pain will eventually destroy your spine. And that's because these areas here, your spine, when they're not moving right, when that joint is not moving right, it degenerates. Any joint in your body that doesn't move right degenerates. And so this is why it is so important. Now, can anybody here, can we all feel our spines degenerating? No. No. How many of you in here that I've x-rayed have seen degenerative arthritis of the spine on your x-ray and didn't have any pain in that area, or very little? Yes. Probably all of us, right? We don't even know what's happening, okay? So by the time we start feeling it and experiencing it, guess what? It's a little late in the game, okay? So think about this. Do you remember the first heart transplant back in the 60s?
Bernard.
Yeah, Dr. Christian Bernard, South Africa, celebrity surgeon. I mean, guy was famous and a celebrity, you know, so, you know, and that was a pretty big deal. The guy that, remember the name of the guy that got it?
Nope.
His name was Louis Washkansky, okay? He died, you know, I don't know, half day afterwards. So now we do heart transplants are like run of the mill, right? So you get a heart transplant. Can you get a kidney transplant? Sure you can. Liver transplant, lung transplant. Can you get a tooth implant? Of course you can. Yeah. Can you get a hip implant? Fake hip, fake knee. Can you get a spine and nervous system implant? No. So don't you think it's worth keeping your nervous system and your spine healthy? Because we are hundreds of years away from being able to implant a central nervous system and a spine. You cannot get that implanted. So people ask me about, you know, should I get a new knee? Should I get a new hip? I hear this stuff all the time. But here's the thing you need to worry about. You need to keep your spine healthy. I mean, you can get rid of all your teeth. I want to hang on to mine, but, you know, you can get rid of them. But you cannot get rid of your spine. You can't have your spine pulled out of your body like your teeth and have a fake one put in. It doesn't work. So if you look at the origin of life, it's really triggered by what happens in the central nervous system. So the brain is constantly doing its best to make endless observations and adaptations to keep your body alive, okay? So even if you never exercise and you live off of junk food, your brain, which, you know, describes about half of America, really.
Over.
Yeah. Who said over?
I did.
Oh, okay. Yeah, okay, you said it. All right. So I was being conservative there, okay? Your body, your brain is going to do everything it can to keep you alive. And there's a story I tell. It's happened in England several years ago. This 16-year-old girl collapsed, just collapsed, and they took her to the emergency room. They couldn't find anything wrong with her. Said, we don't know what is wrong with this girl. So they started talking to the mother. What they found out from the mother is that the only thing she'd eaten since she was 2 years old was chicken nuggets. She wouldn't eat anything other than that. So that's all she ate. So her body did everything it could to keep her alive and to keep her going until it couldn't do it anymore, because you can't live off of chicken nuggets, okay? Can't do it, all right? So recent published research, this is one of my all-time favorite studies, has conclusively demonstrated that loss of curve in the neck diminishes the neurological communication from the brain to the body and the body to the brain. When the curve is restored, normal nerve transmission is also restored. Now, in this study, you know how they restored the curve in the neck? They didn't even adjust these people. They put them on a Denerol 3 days a week. You know those things I have you do at home? That's what they did. They put them on a Denerol 3 days a week for 20 minutes. That's how they restored the curve. That's how the study was done. Pretty interesting. The same is true with blood supply of the brain. When the neck is not curved properly, the vertebral artery is kinked and the brain does not get a normal nerve supply. This is also a good study that was published in a pretty prominent journal. So this is what a normal curve should look like, okay? That's the vertebral artery in the green. That's how it should go. When it looks like this, you get a diminished blood flow to the brain. The brain can't work as right. That's why I'm constantly on people about, are you doing your neck traction exercises? Because I want their necks to look like this as much as possible. Okay, so I'm just going to go over this slide real quick. Pain may be fully or partially in the brain. So here's the thing. If you have pain for a long period of time, if that part of your body heals, you may continue to feel pain there. Anybody know why?
Phantom pain?
Pardon me?
What is it? You mean like phantom pain?
Yeah, well, yeah, phantom pain. If let's say you have pain,
It's it's a memory.
Yeah, that's close because hi Terry.
Hi.
Pain is primarily experienced in the brain. You may think it's down here, but it's primarily up here. So when you understand that, then when that area starts to get better and you still feel pain there even though it's healed, you know that it's coming from here, and you can train yourself not to feel pain just like you train yourself to feel pain. Now, I go into that a little bit more in one of the other talks that I have, but it's a really, really important concept.
So if you had like a knot in your calf, the pain is not ever going to really be down there. It's going to be in the head. In the brain.
You experience pain in your brain. It feels like it's down here, but you're actually experiencing it up here.
What's that talk called that you're going to be going on? Or give us
It's a talk on the brain, or on maybe chronic pain.
Okay.
I have to go look. Okay.
Interesting. What's right here? So.
Okay. Let's talk about the awe of the central nervous system. So the central nervous system starts with two cells, sperm and egg, which divide exponentially. So the first thing that happens in the body when a sperm and an egg come together, it starts dividing and then it starts differentiating. You form what's called the notochord,
Right.
and the spine and the brain and the spine is called the notochord. So the central nervous system is formed first. Why do you think that is? Why do you think that the brain and the spinal cord are the first things that are formed in the body when a child is conceived?
Well, the brain is like the master of the whole body, so it tells your body to develop,
Good.
grow.
That's a great answer. Bingo.
Good job.
Yeah, that's it. That's the answer. The brain directs the body and the rest of the organ development. Okay? This is why a couple of weeks ago, I was talking about toxicity. That's why, when in the first trimester of pregnancy, there's that window of several weeks where if that fetus is exposed to toxicity like plastic and things like that, that can really affect development because you're talking about the brain and the spinal cord. So organs grow off the nerves directed by the brain. So the body tries to protect things appropriately. So vital organs are protected by the ribs. Do you think that there's any coincidence that the brain and the spinal cord are encased in bone? That shows the importance of that system. By weight, bone is 9 times stronger than steel. Okay? Now, subluxations, which cut off nerve supply, have been described in 4 different ways, and I won't spend a lot of time on this, but the number one is dysfunctional movement of a joint irritating of a nerve. The second way that it's been described is inflammatory processes of ligaments and discs and other tissues surrounding the nerve where they exit from the bones. The third is outright compression of a disc, of a nerve by a disc, and you can see that on an MRI. Here's the thing that's really interesting, though, and most people don't know this. There have been studies, lots of studies that have been done with MRIs, where they've done MRIs on all symptomatic and asymptomatic patients. You know what they find? They find a lot of asymptomatic patients have herniated discs with the disc pressing on the nerve in the lower back, and they don't have any pain. And they find people that have no disc pressure on an MRI and are in tremendous pain. Isn't that interesting? So it's not always this causing it. Here's the other thing. You know, when the MRI came out, and the MRI is a great tool, I'm not criticizing it at all. Amazing tool. When it came out, one of the things that happened is, you know, orthopedic surgeons and neurosurgeons they'd look at the spine, and somebody come in with tremendous pain, like pain down their leg, okay? And they see this disc, you know, this herniated disc, and they go, that's it. That's what we got to fix. So they go in there and fix that, and this happens a lot. Mm-hmm. Guess what? Patient wasn't any better. Still had pain down their leg. Because that wasn't the cause. Mm-hmm. That may have been an adaptation of the body to what was really going on. That's really what happens. Okay? Now, sometimes it fixes it, but they found out that just because you saw that on an MRI doesn't mean that that was the issue. Okay?
Is that like a miscommunication of your nerves? Like a nerve synapses, the connections of your nerves? Is that maybe a misconnection?
You could call it, that's a way that you could describe it. Maybe the problem was up here, and the herniation was down here, and this was a compensation for what was going on up here.
That's true.
You see what I'm saying? In other words, the spine is a much more complex part of your body than most people think it is. Like, you know, one of the things people think is, you know, why can't you just put in a rubber disc, you know, if you have a bad disc? Well, first of all, your body rejects things that aren't part of the body. But there's no such thing as even a disc replacement. We have tooth replacements, knee replacements, hip replacements. There's no such thing as a disc replacement. That's why we got to keep them as healthy as we can.
And I knew this gal that had knee problems, and they did everything and checked, and there was nothing wrong with her knees, and what she ended up is having a benign tumor in the foramen around her spinal cord, and it was compressing it. She was almost going to be paralyzed from the waist on down. If they wouldn't have caught it in time.
Those things happen.
But it was her knees that felt it.
Knees that hurt. Symptom here, problem here. Okay.
That makes sense now that you said that.
Yeah, that's exactly right. So here's a fourth way of looking at subluxation: an electromagnetic charge from an inflammatory response creating tissue changes which emits alteration in tone in the electrical field. So now we're talking about electrical field differentiation between the tissue. So which one is it? I don't know. You know, it could be any of them. But they're all pretty descriptive of what might be going on. So here's the thing is, scientific evidence proves that people with this form of dysfunction, a subluxation, when adjusted, reveal a response that enhances function and decreases problems, okay? So there's 3 ways to look at chiropractic. Number 1, I don't believe in chiropractic. Anybody ever run into anybody like that?
All my life.
Yeah. Yeah, when I decided to go to chiropractic school back in the 70s, they seemed like they came out of the woodwork, you know? Chiropractic is only good for pain relief, like a natural aspirin. You know any people like that? Oh, yeah. You know, and it is good for pain relief. Chiropractic enhances the way my entire body works, and thus the expression of life and organ function. This is really what chiropractic is about right here, right there. So chiropractic is not designed just to make you instantaneously feel better. It's designed to instantaneously help you heal better instantaneously. So when you correct the nerve supply to the body, things happen. Now let me tell you a story about a patient of mine. It's an older patient. I think she's probably late 70s, maybe 80. Well, she came into me, she didn't have a lot of like your normal neuromusculoskeletal symptoms that people have. But she just wanted, her main thing is, she just wanted to be healthy. And she had to go to the hospital every year. She'd get sick and end up in the hospital. And so we x-rayed her, examined her, x-rayed her. She had an enlarged heart, scoliosis, curvature in her spine, enlarged heart. So I started working on her, and she's been a patient of mine for a while now. Last year, she was so excited. She never had to go to the hospital. But she didn't have any of the typical pain that people have when they come in to see me. But she did not have to go to the hospital. Why? Because her body was healing. Now, could she notice a lot for a long time? Not really. She didn't feel that much different. But over time, she realized, wow, I don't get sick like I used to anymore. My body, I don't wind up in the hospital like I used to. See, that's really what chiropractic is about. So if you look at the loop between the brain and the body, do you think a liver trying to detoxify needs 100% nerve function? Yeah. Now, do you think our livers have to detoxify in the environment that we're in? Literally all the food we buy is in plastic. Yeah, it does. Needs 100%, okay? So if somebody has a liver enzymes that are high, is it possible that part of that could be coming from the spine to the liver? Interference. Does a heart require 100% nerve flow without interference from a subluxation or work problem? Absolutely it does. Heart's very electrical, so it requires 100% function. So Keith Wassung, and he's the one that did those slides that I have running up there. Yeah. Here's what he stated: thinking chiropractic is only pain relief is like robbing a bank and stealing only the pens. I always wondered why the banks that I go to, they used to have those pens chained up. I'm going, what's this all about? I don't want your pen. Are you guys that cheap? Anyway. So here's the thing. If we look at the medical way, traditional medical way of dealing with back pain, what do they do first? A lot of times inject it with cortisone, right? Cortisone. So, got back pain? Let's inject you with enough cortisone to kill enough nerve endings to reduce the swelling so you don't know there's a problem there. So you can go back to work and re-injure your disc even more. That does not make sense to me, okay? Now, I'm not saying that nobody should ever have cortisone. I'm not saying that at all. I'm saying that this is not health care. This is crisis care right here, okay? That's what this is. Now, there's a study in December 2019, so it's pre-COVID, in the journal Radiology. that stated the following regarding steroid injections. It came right out of this study. Number one is steroid injections accelerated osteoarthritis progression. Steroid injections cause subchondral, which is right here, insufficiency fracture, complications of osteonecrosis. Osteonecrosis is the death and disintegration of bone, and rapid joint destruction with bone loss. Okay, so that's in a major medical journal. Anybody want any of this? I don't, you know. So steroid injections aren't nearly as safe as what you think they are. And repeated steroid injections over time can cause this scenario right here. And that's right out of a major medical journal. So chiropractic may be slower than a shot, but it's much more in tune with your body's need to feel safe. So if your body's giving you pain, it's for a reason. So, you know, if the oil light comes on in our car, we don't take the screwdriver and punch it out or cover it up with tape. We put oil in as fast as we can, otherwise what's going to happen?
Breakdown.
Engine's going to blow up, and that happened to me when I was 16. It was ugly, and I won't talk about it. Okay, so anyway, I learned something about the oil light back then. So covering up symptoms doesn't make any sense. Symptoms are there for a reason. Now, if we look at, and this is one of the questions that I have on the little quizzes that I give on the 12th visit. Research has proven that even a minor subluxation can shut down 60% of nerve flow. And that's what we have these dimes out here for. It's the dime challenge, is that when you put a dime on your wrist, that much pressure will shut down 60% of nerve flow. So you don't need a lot, okay? And that was that was research way back in the 70s when I was in chiropractic college. That was one of the first chiropractic papers that was ever published. Only 10% of your nerves deal with pain. The remainder support function. What is that? What are the implications of that?
You'd be pretty far gone before you'll feel the pain.
Yeah, you can lose a lot of function and not even know it. And I see this all the time in practice. You know, people come in and, you know, I'll test their extremities. I have to hold your arm out, you know. I'll just test it. They can't hold it up. You know, you got to be able to hold your arm up against pressure. That's loss of function. Unfortunately, I can fix that most of the time. But yes, loss of function. They don't have pain in their arm, but they don't have a lot of strength in their arm. They didn't even realize it. Okay, so an individual who has a nervous system is free of interference can fight off infections and sickness much easier, just like this patient I was talking about. So let's look at kids. Kids who are subluxated, they may not feel pain. They may not feel the pain that we do, but here's what they experience. Chronic colds, allergies, food intolerances, behavioral issues, ear infections, sore throats, all which stem from interference between the brain and the body and the body and the brain. And when you adjust kids, they are so much healthier. I have families that bring their kids into me, and their mothers tell me, our kids are so much healthier when they're adjusted. And I look at kids that are sick a lot. The first thing I'm saying is they don't need more antibiotics. They need to get adjusted. We need to fix this issue of the brain to the body and the body to the brain. But so what do antibiotics do to kids? Let me ask you that.
Kills their immune system.
Yeah, kills all the good bacteria, gut bacteria. And what does it set them up for later on?
Resistance.
Autoimmune disease. Okay? So there's an article in a prominent neurobiology journal in 2014 that stated the following regarding the nervous system in the upper neck. This nervous that comes out of the upper neck controls breathing, heart function, and really influences the entire autonomic nervous, all the organs, okay? And this is the thing that people can't understand about chiropractic. They say, are you going over and over and over again? Well, why don't you stop? I mean, didn't they fix the pain? Well, maybe it's not about pain. Maybe it's you just want to be healthy. I get adjusted every week, every single week. I'm not in pain when I get adjusted. I get adjusted because I want to stay healthy. I want my body to be as dynamic as possible in resisting disease and all the other things we're exposed to. It's like, we brush our teeth so they don't hurt. No, we brush our teeth to keep them healthy, okay? We brush and floss our teeth. And by the way, although I do absolutely believe in brushing and flossing, I don't think that's the thing that keeps teeth healthy. It's your diet. If you constantly drink pop, Coke, let's say you drink 4 or 5 Cokes a day, I don't care how much you brush and floss your teeth.
Yeah.
Your teeth aren't going to be healthy.
Yeah.
Okay, so, the Tour de France riders get adjusted every day. Racehorses get adjusted. Animals are so much healthier and live longer when they're adjusted. I adjust animals here on Saturday. Someone asked me a couple weeks ago if they could bring their steer into my office. I said, no, you can't. Don't you dare bring that thing into my office, okay? I'll come out, I'll drive out, but you're not bringing that into my office.
We'll leave some surprises for you.
Into the parking lot.
Yeah, so, no, I'll drive out.
Make house calls.
Yeah, on those kinds of animals I do. So here's the bottom line, is that we know that we need 100% of our nervous system to stay healthy. We know we have to have that as much as possible. So, and it's my passion to help people with that. So if you have friends or family that at least want to get checked, at least want to get their nervous systems checked, we do that at our expense. Okay, we're having a Patient Appreciation Day coming up April 6th. We're going to check patients that day. We'll give them spinal health checks. We can help them. We'll tell them. We can't. We'll send them to where they can get help. But that's all we want to do, is help people get better and stay healthy. Help this community to be a healthier community, which is why I give these talks. So you can, most of you know somebody that probably needs to get checked. Tell Carmen, she'll schedule them, we'll check them out, and we'll be glad to do that. So that's all I have tonight. Kept you 3 minutes over. Yes, Randy?
When you get regular chiropractic care, but you have a stressful life, that can really not keep you as in chiropractic care, right? Because the stress is counterproductive, right?
Well, the chiropractic care is going to help you handle the stress. That's the way I look at it. It's going to help you handle the stress a lot better. Because if you're living a stressful life and you're not getting chiropractic and you're subluxated, how's your body, how can it function right? And you have muscles that are tightening up and causing subluxations and nerve interference. You cannot be healthy like that. Things are going to break down and you're not
counterproductive.
Yeah. But to get adjusted, if you get adjusted regularly, I mean, most people I know are under stress. Okay, so you get adjusted regularly. It's going to help you handle it a lot better. That's the way I see it. That's the way I've experienced it in my own life. Okay. Okay, good. Are we good? Anybody else? Thank you so much for coming tonight. And in 2 weeks, we're going to be talking about how herbal therapy affects the body, how herbs and vitamins differ, and what they do differently. So, God bless you guys, and see you in a couple weeks.